What scientific breakthrough are we closer to than most people realize? They're hoping that a new drug will be available for use by 2030 that essentially grows your teeth back. It stimulates stem cells in your tooth pulp and encourages growth. Also, to my understanding, this drug was originally being tested as an Alzheimer treatment in Japan. Early diagnosis and treatment of Parkinson's, I think. I've been following a story for a few years now of a woman who could smell Parkinson's and is now working with researchers to turn her weird unique ability into an early screening test. Curing addiction with a diet drug GLP-1s. There have been lifelong alcoholics, drug addicts, people with eating disorders, gamblers, etc. who've lost all desire for these things while on Ozempic, Wegovy, and semaglutide. They're conducting studies already. Insanely effective cancer treatments. Cell therapy is absolutely crazy, and it's available for a fair few diseases. I have a lot of family that works in different pharma companies. We were recently discussing that there is a very promising treatment for Alzheimer's in the works that could stop the progression of the disease and maybe reverse some of the brain damage. It's still in testing phase and wouldn't be on the market for years, but it's something that would be awesome to be able to use. A cure for HIV seems to be on the horizon. Some scientists managed to cut it out of cells using CRISPR last year. This is rather an engineering issue, but a lot of scientists are working on this as well. RGB micro-LED displays. We can currently build fairly efficient blue and green micro-LEDs from indium gallium nitride, but the red ones are missing. Red LEDs have been available for much longer than their blue counterparts, but we currently cannot make them small enough for a high-P display. Many researchers and companies are trying to get the red ones working with several different approaches, and I believe we will see the first commercial applications, starting from smartwatches, smartphones and our VR goggles within the next 5 years. Synthetic biology. Shit's going to get weird real soon. Genetic editing. I think we'll soon see news of experimental gene therapy treatments for cancer, diabetes and, perhaps, Alzheimer's. CRISPR-9 and all. The next logical step would be designer babies. Brain-computer interface. I worked on one 10 years ago. It barely worked, but you could see the potential. However, a few weeks ago someone played a 6-hour Civilization 6 session using only their brain. Understanding how hormones and mental illness are linked, especially in women who previously were diagnosed with mental illness but who had endocrine disorders. And to add, menopause in response to the Lancet's awful claim of over-medicalization. Scores of researchers the world over have doubled down to learn more. Checked the top posts for hair loss treatments and there was nothing mentioned. Going to go cry now. Semaglutide, Ozempic, Wegovy in pill form at a greatly reduced price. Wegovy also has been proven to reduce cardiovascular disease in particular and make recurring cardiac events less likely for patients who've already experienced a cardiac event. Some independent pharmacies are already creating semaglutide pills. mRNA-based cancer treatment. Within a decade it will render chemoradiation obsolete. I've heard we're really close to re-enamelizing teeth. That would be huge. My stupid genetics can go to hell. A technological leap forward in battery storage capacity, cheaper and lighter weight. This will have the biggest impact on everyday life. Large-scale water desalination. It may seem trivial to most people, but access to fresh water and water purification are the largest problems on the planet. Desalination has been extremely expensive for years and never has the investment needed to break the scalability barrier. Well, our friends in the Middle East claim to have made some huge accomplishments over the last few years thanks to graphene and access to abundant power. Their new plants should be coming online next year. Not having to worry about access to clean water would mean massive jumps in agriculture, industrialization and population. Susan Shore's Oracle device is capable of treating tinnitus, reducing volume by up to 75 after 12 weeks of treatment and is approved for FDA. To not be able to trust any digital images, videos, or audio you see anywhere. Politics are going to go straight into a dumpster fire among countless other scandals, relationships, and virtually everything. Get ready. What a great thread. Thanks so much for asking this, up. Believe it or not, communicating with animals by translating brain waves into human language. Apparently, AI research is on the verge of doing so. To-go containers for French fries that will keep them both hot and crispy. The breakthrough happened cleaning the oceans of garbage. Now it needs to be more than a ship or two. I don't think anyone thinks about cystic fibrosis, but from the 3 years I went from learning about it in medical school to seeing the treatment in residency, people live legitimately normal lives with a disease that had an average lifespan in the 20s only years ago. It brings tears to my eyes and hope for what we can do going forward for a disease that was an early death sentence mere years ago. Digital dentures. Custom built to the customer and made en masse for a fraction of the price via 3D printers. The first Alzheimer's survivor is alive right now. People who were once paralyzed may be able to walk normally again. A few years ago, Israeli grew human spinal tissue in mice. They then used that spinal tissue to get some paralyzed mice to walk again. Another positive is BC the spinal tissue was grown naturally, you won't need anti-rejection meds. Drugs that slow or even reverse the aging process. I think people are underestimating the impact that these weight loss drugs are going to have. Once they are generic in 10 years, they'll be changing our entire medical system. People will no longer suffer all the effects of obesity, so rates for things like obesity-related heart disease, various cancers, diabetes, etc. should all plummet pretty dramatically. We'll have an enormous economic and demand impact on the medical system. The drugs are also a potentially effective treatment for addiction as well. Studies are underway as we speak. A cure for or the reversal of Alzheimer's. There was just a 60-minute special about the work one hospital system is doing, and it implied we're about 4 years away. Nanotechnology is quietly advancing, promising breakthroughs in areas like targeted drug delivery, renewable energy, and even pollution control. Solid-state batteries should be a TKO against combustion engines with the charge time and manufacturing capabilities unlocked. I don't know, but it's not curing diabetes. They said it'd be cured in 10 years, 20 years ago. Artificial intelligence in medicine and surgery. We have already started using it. It's just a matter of time when healthcare will be dominated by it. I've seen more and more blood tests in development to diagnose diseases that typically require a biopsy to confirm. Would have been great to not have needed a craniotomy in the middle of a pandemic. Artificial wombs. Already have biobag wombs used on premature sheep and pigs. Soon to go to human trial for premature babies in the USA. Probes eventually will be able to support a fetus earlier and earlier in gestation over time. Cool stuff, cool face.